I assisted my patient. Then something occurred. I entered the compact, poorly illuminated examination room, clipboard in hand, my heart racing somewhat quicker than normal. This was not my initial experience aiding in a patient's examination. However, something about this specific task rendered me quite disconcerted. As a nurse in a bustling downtown clinic, I had encountered numerous situations. Yet what was going to transpire with Thomas Blackwell was unprecedented and unforeseen. He was a reserved individual in his early 50s who typically maintained solitude. He presented for standard blood pressure and heart evaluations, with no abnormalities observed. I had previously assisted him, but today seemed distinct from the time I entered the room. He was already seated on the bed, his posture rigid and hesitant. His eyes flitted across the room, and he shifted uneasily beneath the flimsy medical robe. "Good afternoon, Thomas Blackwell," I stated softly, presenting a gentle smile as I entered. "Are you well today?" He nodded rapidly. However, I noticed the discomfort in his gaze. Something was amiss. "I will assist you in preparing for the exam," I stated, approaching to adjust the monitoring apparatus and arrange his gown. However, as I progressed, I observed something unforeseen through the sheer material. My gaze instinctively descended, perceiving the obvious form concealed beneath the gown's drapery. I momentarily became immobile, my face reddened, and I promptly averted my gaze, reminding myself to maintain professionalism. I served as a nurse. I had been prepared for uncomfortable circumstances. Such occurrences transpire occasionally. It was merely anatomy. The abrupt and unforeseen manner of its manifestation unsettled me more than anticipated. I instructed, clearing my throat and adjusting the bedding once more. "Let us proceed to position you for the doctor." However, as I progressed, he adjusted once more, this time with excessive rapidity. The gown's edge detached entirely. All was revealed. I inhaled sharply, instinctively pivoting my head in an effort to regain my composure. My mind surged with myriad notions. Should I address it? Exit the room? Act as if nothing occurred? Prior to my decision, the door creaked open behind me. "I apologize for the interruption." A voice emerged, belonging to another nurse, who peered inside. She blinked briefly, evidently perceiving some anomaly, then swiftly withdrew, securing the door once more. I glanced back at Thomas Blackwell, who was utterly horrified. He hastily attempted to conceal himself. However, the palpable tension remained pervasive in the atmosphere. His face was crimson, and he gazed at his lap. Evading eye contact, he whispered an apology. I inhaled, attempting to regain composure. "It is acceptable. Let us prepare you for your examination. Will we?" As I turned to retrieve new linens and supplies, I unexpectedly felt his hand graze mine. I became immobilized once more. The interaction was subtle, seemingly inadvertent, yet its lingering quality prompted me to ponder whether it was genuinely an error or an implicit communication. My skin tingled, and for a few period, I remained motionless, unsure of how to react. My professional intuition advised me to disregard it and proceed, although my instinct urged caution. At that moment, the door opened once more. At this moment, it was Dr. James Holloway, entirely oblivious to the recent events. "Is everything satisfactory at this location?" he inquired jovially while perusing the patient chart upon entry. "Affirmative, doctor," I stated promptly, moving aside. "Thomas Blackwell is prepared." I refrained from looking back. I required an exit from the room. As the physician commenced his standard inquiries, I discreetly departed, my heart still beating. The door latched behind me. Yet the unease persisted. Later that afternoon, when I was conducting my routine rounds and reviewing chart updates, my phone vibrated with a notification from the front desk. "Thomas Blackwell has expressly requested Maya Ellison for tomorrow's follow-up appointment." I gazed at the letter, my stomach churning. Why am I the chosen individual? Did I commit an error? Was it merely due to my observation of something I was not intended to witness? Or had something more profound begun to establish itself? The subsequent day arrived more swiftly than I anticipated. I stood outside Thomas Blackwell's room once more, inhaling deeply prior to knocking. I instructed myself to remain composed, professional, and aloof. However, upon the door's opening and our gaze intersecting, The discomfort resurfaced immediately. This time he smiled, but it was not the timid, mortified grin of the previous day. It was distinct, more certain, more regulated. He stated gently that he had been contemplating you. My heart raced before I compelled a faint laugh. Let us concentrate just on your examination. Thomas Blackwell, I stated assertively, endeavoring to maintain the discussion's direction. However, as I approached his foreline, my thoughts accelerated. There was an anomaly present. I harbored a disquieting sense that this was merely the inception. The following morning, I entered the clinic resolute on maintaining my distance. The preceding day had rendered me disquieted. I often reminded myself that I was overanalyzing the situation, that perhaps Thomas Blackwell was merely socially awkward and ashamed, and I was allowing that to affect my thoughts. However, I subsequently recalled his request. He had explicitly requested my presence once more. That smile was not a figment of my imagination. I occupied myself with other patients, managing morning vital signs and documentation. At approximately 10 a.m., the front desk notified me that Thomas Blackwell is prepared in examination room 3. He has requested you explicitly. My gut churned. I seized my chart and squared my shoulders. This time, I will ensure that nothing remains ambiguous. I will be forthright in, if need, aloof, persevere through it. Upon entering the room, I observed Thomas Blackwell seated upright, attired once more in a hospital gown. He appeared at ease, excessively so. His hands rested in his lap, and his countenance was inscrutable. Greetings of the morning. I greeted him, attempting to maintain a swift pace. Let us prepare you. He smiled at me once more, the same disconcerting assurance evident in his eyes. I am pleased that it is you. I halted. Let us concentrate on your treatment today. He remained silent as I approached, adjusting his foretubing and examining the monitor. I maintained a methodical demeanor, ensuring not to tarry. As I moved slightly to adjust the cuff on his arm, he said again softly, almost conspiratorially, I had been contemplating you. My jaw tightened. Thomas Blackwell, my role is to facilitate your care, not to partake in personal dialogue. He exhibited minimal reaction, merely smiling as if he had anticipated that response. His gaze tracked my movements with disquieting intensity. Unexpectedly, the door swung open. I was almost startled, relieved to observe another someone enter. However, my relief was ephemeral. The individual was not the physician. A woman in her mid-40s, possessing sharp features, was well dressed but not attired in scrubs. She entered with intent, her eyes surveying the place. Her gaze fixed on me before transitioning to Thomas Blackwell. Her voice was serene yet strained. Am I intruding upon an ongoing matter? Thomas Blackwell's demeanor wavered little. No, not in the slightest. I straightened, my heart racing. I was concluding my tasks. I will leave you both alone. I maneuvered past her and exited into the corridor before she could utter anything further. Upon the door's closure behind me, I sighed sharply. The woman's visage remained distinct in my memory. Her penetrating gaze and measured tone. That was his spouse. I need no validation to ascertain it. She was aware, or at the very least, she harbored suspicions. At the nurse's station, I attempted to dismiss the experience from my thoughts. However, I could not cease contemplating the expression she sent at me, as if she had witnessed something in that place that was not meant for her eyes. I was uncertain whether I had just departed from a perilous situation or an embarrassing one. Subsequently, that afternoon, I was categorizing files when another mail arrived. Thomas Blackwell has requested your assistance again tomorrow for the follow-up examination. I gazed at the screen, astonished. I had to terminate this. I inquired with the head nurse, Dana, about the possibility of assigning another caregiver to Thomas Blackwell for the following day. He appears perhaps overly at ease. Ryan blaked cautiously. I would want some distance. Marcy Roa scowled. We are little understaffed tomorrow, nonetheless. I will explore potential solutions. I felt unsettled. The subsequent day arrived more swiftly than I desired. I reviewed the roster. My name remained adjacent to Warren's. I inhaled deeply and steeled myself. This time, I was not merely entering as a nurse. I was entering with limitations. I was prepared to elucidate those points. Upon my entrance inside the room, he was already present. The atmosphere felt distinct this time. He was not smirking. He was not at ease. He gazed out the window, his hands tightly clasped in his lap. I wished to converse with you, he stated softly, without looking around. I remained stationary at the threshold. Regarding what subject? He gradually rotated his head, making eye contact with me. Regarding prior events, I remained in my position, maintaining a composed tone. I am present to facilitate your care, Thomas Blackwell. Any additional matters should be addressed with the administration. He gradually shook his head. There is no necessity for pretense. I am aware that you experienced it as well. I experienced a shiver descend my spine. I believe you have misinterpreted my statement, I asserted emphatically. Your assumptions regarding the occurrence are incorrect. He inclined his body forward slightly. You did not depart the initial occasion. At that moment, the door creaked open once more. The individual was not the physician. It was she, his spouse. She entered silently, her gaze swiftly traversing the room, first settling on me, then on him. What is occurring here? She inquired nonchalantly. I withdrew. I was departing. As I exited, I sensed her piercing eyes trailing me. In the corridor, I exhaled a breath I had not recognized I was retaining. Something was profoundly off, and I harbored a dreadful premonition that this was not concluded. The remainder of that shift felt as though I were traversing through mist. Each time I traversed the corridor adjacent to examination room 3, I became apprehensive, anticipating the re-emergence of Thomas Blackwell. Or, more concerning, his spouse. I maintained my concentration on charts, vital signs, and patient assessments, striving to suppress the underlying discomfort. However, I was unable to cease contemplating his gaze, his utterances, or the unsettling tranquility in his wife's voice when she entered and inquired about the situation. The persistent notice on my work tablet stating, Thomas Blackwell has requested you for his next visit, was unhelpful. It like an inescapable shadow. By day's end, I was fatigued. I clocked out and proceeded to the staff exit, ready to vacate the building and inhale some fresh air. However, when I turned the corner, I observed him. Thomas Blackwell stood at the double doors, clad in his coat, awaiting. I halted abruptly. I merely wished to converse, he stated, his tone subdued and informal, as if we were two acquaintances reconvening post-work. I surveyed my surroundings. A few nurses continued to pass by the nurses' station. However, none appeared to take note. Thomas Blackwell, this is inappropriate. He advanced nearer. There is no need for you to fear me. I am not afraid. I was untruthful. However, I feel uneasy. You have exceeded acceptable boundaries. Before I could depart, a voice summoned me from behind. Jenna. Ryan Blake, a junior staff member from the radiology department, was present. He was gesticulating and smiling. I reflexively went back toward him, appreciative of the diversion. Upon my subsequent turn, Thomas Blackwell had retreated, his expression inscrutable. He murmured once more. I departed without uttering a word. The following day, I informed Marcy once more that I required another individual to assume responsibility for Thomas Blackwell's care. She assured me she would explore potential solutions. Nevertheless, given our limited workforce, I remained skeptical. I completely circumvented his hallway, occupying other spaces in an effort to restore a semblance of normalcy. That afternoon, while taking a brief respite in the staff room, I received a notification on my tablet. Patient Warren is requesting Maya Ellison. Immediate attention required. My gut churned. I nearly deleted it. Nearly disregarded it. However, I did not. I retrieved my identification, adjusted my scrubs, and proceeded to room 3. If he attempted anything again, I would promptly terminate it. Upon entering the room, I anticipated that he would commence speaking immediately. He did not. Thomas Blackwell sat on the bed's edge, gazing out the window with an even more solemn expression than previously. I require a conversation with you, he stated, avoiding eye contact. I maintained a neutral tone. Concerning your care? Negative. What transpired? I remained adjacent to the door. Thomas Blackwell, I have already elucidated. He pivoted, interrupting me. Do you believe you are the alone individual experiencing confusion? I closed and opened my eyes rapidly. Surprised. I have no desire to engage in games, he stated, gradually standing up. However, one cannot refute the presence of something significant here. You have not disclosed this information to anyone. That signifies something. This indicates my intention to maintain professionalism. I lost my composure. He advanced, although I maintained my position. Suddenly, he extended his hand and seized my wrist. I exclaimed, retracting my arm promptly. He offered a subtle smile. Will you refrain from disclosing this to anyone? Because you understand the appearance of this situation. At that moment, the door creaked once again. His wife stood close outside, slightly in shadow. She had been present sufficiently long to overhear something. Her demeanor was frigid, utterly inscrutable. She remained silent, merely gazing. I retreated swiftly, exiting the room without a more look at either individual. My heart was racing intensely, causing pain. I was unaware of what Vivian Cross had perceived. I was unaware of her beliefs. However, I was aware that a transformation had occurred. Later that evening, as I was preparing to depart the clinic permanently, I observed Vivian Cross once more, awaiting at the front desk. I require a word, she stated succinctly, her tone subdued yet unequivocal. I vacillated, yet acquiesced. She guided me into a modest and utilized office located down the corridor. As soon as the door shut, she turned to confront me, arms folded. I am aware of your actions involving my husband. My heart sank. No, ma'am, it is not as you perceive. Do not deceive, she retorted. I have observed his gaze towards you and your subsequent reactions. I have not engaged in any inappropriate behavior, I stated, attempting to maintain my composure. You are not the initial one, she stated icily, but you may be the final one. With that, she departed, leaving me solitary, the atmosphere oppressive around me. The boundaries had become indistinct. The regulations had altered, and whatever this situation entailed, it was not concluded. The subsequent days unfolded in a haze of anxiety and vigilance. I remained at the periphery of the clinic, completely evading exam room 3. I altered my break schedule to maintain distance from Thomas Blackwell and his spouse. However, the burden of the events that transpired remained with me perpetually. Her admonition resonated in my head akin to a ticking clock. Nevertheless, nothing equipped me for what followed. The evening was advanced, and the most of the staff had departed. I was doing paperwork at the nurses' station when I observed Thomas Blackwell standing solitary at the end of the corridor. Awaiting, my breath was momentarily halted. He was not meant to be present any longer. His examinations were complete. What was the reason for his persistent presence? I rose, prepared to depart by the rear exit. However, as I rounded the corner, he advanced. Jenna, he Ryan blaked, his tone subdued, nearly fatigued. I require a conversation. I believe we have communicated sufficiently. I responded promptly, attempting to bypass him. He obstructed my progress softly, not with aggression, but sufficiently to compel my attention. She conversed with you, did she not? He inquired. I acquiesced, maintaining an erect posture. Indeed, she did. I believe it is prudent to terminate this situation before it escalates further. However, rather than retreating, he smiled slowly, creating a disturbing effect. She is unaware of the entirety of the situation. It was then that I experienced it once more. That tension, that peril. Prior to my response, he extended his hand and seized my wrist. Release me. I broke free, pulling myself away. This constitutes harassment. He stated calmly that you would not report him, as you are aware of the outcome. Your assertion contradicts mine. I began to speak, but I halted when I noticed his wife waiting behind him, just beyond the shadows of the corridor. She had comprehended all that was said. The corridor became abruptly frigid and quiet. Thomas Blackwell halted, comprehending what I was observing beyond his shoulder. He rotated gradually. Vivian Cross stood with her arms crossed, her expression devoid of emotion. However, her eyes were incisive and analytical. Is everything satisfactory here? She inquired, her tone excessively composed. I instinctively recoiled. I was departing. I navigated by both individuals without uttering another word and hastened for the exit, while my heart continued to race. Had she acquired sufficient information to confront him? Will she confront me once more? I preferred not to discover. I believed that would conclude the matter. As I extended my hand toward the door to exit the clinic, I sensed a hand on my shoulder. I pivoted, prepared to respond. It was she, Vivian Cross. Pause. She murmured gently. I gazed at her, uncertain whether to flee or heed her words. However, an aspect of her tone caused me to become immobilized. We must converse. She Ryan Blaked, indicating an adjacent vacant consultation room. I trailed her, with reluctance. Upon entering, she shut the door and turned to confront me. Her countenance inscrutable. She Ryan Blaked that she had observed the way he gazes at you. I am aware of his capabilities. My mouth became parched. What is the reason for this? I am not here to intimidate you, she stated assertively. I am available to assist you. What is it? I am not the lady you perceive me to be, she continued. My husband, Tom, possesses a sinister aspect. He exploits individuals, particularly women. I have saw him perform it previously. I have allowed it to pass till this moment. I remained mute. She retrieved a document from her handbag and presented it to me. Contained therein were photographs, documents, texts, and items that illustrated a persona I had not anticipated. She stated that he had been engaged in this activity for years. Not only nurses, but also colleagues, neighbors, and a family friend. My hands quivered as I perused the contents. She stated, her voice abruptly regaining composure. This matter transcends both you and me. It pertains to power. He will not cease unless compelled by external intervention. I gazed upward. What is the purpose of conveying this information to me? She retrieved a little silver key from her bag. I seek your assistance in revealing his true nature. What is the inquiry? She Ryan Blaked that you are already partially engulfed in the flames. Why not incinerate it? I experienced vertigo, with the room rotating slightly. Was she earnest? Was this an ambush? Or had she genuinely ceased to fulfill the role of the ideal spouse? Prior to my response, she opened the door. Contemplate it, she Ryan Blaked as she exited. However, do not prolong the duration excessively. He is already strategizing his subsequent action. I stood there, folder in one hand and key in the other, ensnared in a profundity more sinister than I had ever envisioned. I now faced a decision: to depart and feign that none of this transpired, or to remain and engage with whatever ensued. Thank you for engaging with the narrative of this episode. Remember to subscribe and explore additional stuff to uncover the myriad intriguing aspects of life. Transcribed via https://otter.ai